Hi, my name's Steve Pugh. I'm from the Department of Health and now Social Care. Thanks very much to Sam for inviting me to speak to you today about some guidance that the government has published in the last 2 weeks digitally on gov.uk about surrogacy, and he's just asked me to give you an overview of that. So just a little bit of background that you're probably mostly all aware of, I would imagine. Legislation has been in place across the UK, the Surrogacy Arrangements Act, since 1985, which allows altruistic surrogacy, and I won't try not to duplicate anything that Colin has outlined. And the most recent legislation was the Human Fertilisation and Embryology Act 2008, which updated the law around legal parenthood. The government has already announced its support for a review by the Law Commission of all surrogacy legislation, and a project is due to start next month on that, and there is a representative from the Law Commission here, which is great. I think it's fair to say that since 1985 up to the last few years, successive governments have been rather cautious about revisiting the legislation. They've also been quite cautious, I think, about explaining the legislation over that period of time. So there's been a gap in this age, this new digital age, this age of new information. There's been a gap of government information because I think parliamentarians have regarded surrogacy as generally quite contentious and haven't wanted to kind of dip their toe in it or put their name to anything. So let me just see if this works. Yeah. So what happened? I think it's probably about 4 years ago now, and I think there's some people in the room who were involved in this. There was a kind of confluence of events that happened. There was quite a lot of media coverage, mostly of international surrogacy arrangements, which for some reason or other hadn't gone straightforwardly, and a lot of tabloid interest in those. There was parliamentary interest through a debate brought by an MP, Jessica Lee, and this was the first debate about surrogacy by itself, you know, for some time, certainly within kind of policy officials' living memory on this subject matter. And what it did was it engaged a small number of parliamentarians in terms of their interest in surrogacy, in the current arrangements of surrogacy, but also got them thinking about more broadly issues for reform going forward. It also engaged the minister of the time in realising that she actually had this issue as part of her policy portfolio in the first instance, but then reflecting on what the government might be able to do in order to clarify its position on its current policy, which appeared not to be clear to a lot of people. So as a result of that, officials at the department undertook some stakeholder engagement over a period of months, and the feedback that we got was that amongst other things, I think there was a broad ambition for legislative reform, which we couldn't deliver at the time. But what we could deliver at the time was a commitment to develop some guidance with the kind of stamp of government on it, which would stand as a kind of authoritative view and explanation of both the government's policy position, the legislation as it stood, and as it turned out, describing in more detail the pathway within the UK for surrogacy. So I've kind of moved on to my points in my next slide. So yes, it's kind of ironic that and those of you with experience of international surrogacy will realise that there is guidance on gov.uk around surrogacy, and it's from the Foreign and Commonwealth Office about international surrogacy arrangements, but there isn't, or there wasn't until we published, any information about the UK-based route, which has been historically owned by the Department of Health. So part of our purpose was to, as I say, to demystify the surrogacy pathway and to highlight kind of the key policy outcomes, if you like, that the government kind of wanted to support for surrogacy in the UK. So we wanted to encourage the use of UK licensed clinics and not informal arrangements which might put individuals at risk. We wanted to encourage the application of parental orders, as explained so eloquently by Colin, in order to secure, children's rights and legal parenthood. And we wanted to try and improve the experience for surrogacy families, because feedback that we had from our engagement with stakeholders was that a lot of intended parents and surrogates were having trouble at clinics around the birth of the baby. There wasn't kind of equal treatment. People were treated with suspicion, or there was an assumption of safeguarding issues, and there was even kind of reported during our development period a case where a baby, the hospital insisted that the child was handed over in the car park because they couldn't allow the child to be handed over on the hospital premises, which is clearly ridiculous. So we decided that we needed to address that. Where are we? And the way that as a project manager within the department, I approached this was as a collaborative process. So I've worked really closely, and I'll give full credits at the end, with all three of the UK altruistic surrogacy organisations. We've had involvement from officials from CAFCAS, the Court Support Service, Sarah from Progress Educational Trust, and a whole stream of representatives from across the healthcare professional bodies. It was clear when we convened, first of all, that there were two separate products. There was one piece of guidance that was necessary for intended parents and surrogates in terms of explaining the pathway from the point at which you decide that you want to undertake a surrogacy arrangement, engaging with the surrogacy organisation, drawing up an agreement, all the way through to the end of the pathway where you've applied for your parental order, you've received that, and then you are considering how to explain to your child the origins of their birth and support them through that. So that was one. The pathway was one project. The other project, and the other piece of guidance, was for healthcare professionals who would be involved in providing care for surrogates and intended parents. So we had a different project team and support network for that. And through the process, we consulted very widely with different stakeholder constituencies. Certainly for the healthcare professionals guidance, we went to all the key national bodies, the RCN, the RCM midwives, the RCOG, the British Fertility Society, who all came back with some warm words and some helpful suggestions for sharpening and improving the guidance, and they've all endorsed the guidance and are distributing it to their members. We also had some additional sense checks, if you like, in terms of reviewing the guidance for readability, because the legislation covers the UK. We also engaged with the devolved administrations, which is a kind of a separate problem, which I'll mention in a moment, and also feedback from the Human Fertilisation and Embryology Authority, who are the regulators for the UK fertility sector. So, where have we got to? So just to give you a kind of idea, it was about an 18-month project. Most of the initial drafting was undertaken by partners across surrogacy organisations. For the healthcare professionals guidance, we reviewed existing practice. There were a lot of local guidelines, some of which were very helpful and some of which frankly were quite horrific. So we took some of the best of that and built on that. As you'll imagine, we were under close attention from government legal advisors in terms of ensuring that we gave a proper and accurate account of the legislation as it affects people. And we also had support from the nerds in DH Digital in terms of how we put it together and how we presented it. As I mentioned, at the last minute, we had some issues with colleagues in the devolved administrations in Scotland and Northern Ireland, and we took the view that rather than delay and complicate the process, because the legislative administration, shall we say, in both of those administrations is quite different from England and Wales. We decided to publish as an England and Wales document and offer what we've done so far as good practice to them to publish their own, and I hope that they will be able to do so, and any encouragement that others can give them will be gratefully received. Then we had to get approval from the health minister of the time, who is now someone called Jackie Daw-Price. She's not really a kind of public figure, but just to give you an idea about how, well, not only how long it took, but also a week is a long time in politics. She was the fourth health minister to have this surrogacy and assisted conception as part of her portfolio. So that's four separate ministers that we've had to explain all of the issues to and get them on side. But thankfully she was very supportive and made some supportive quotes when we launched. So as I say, we launched 2 weeks ago. I think it's fair to say that we had reasonable UK press coverage across the BBC and some of the broadsheets, in spite of intense competition from the Beast from the East and Boris Johnson. We've had really positive feedback from all the healthcare professional bodies around this, and I was really pleased to get some positive feedback this afternoon from colleagues within the kind of legal sector on surrogacy about how well this has been received. it was. I think it's fair to say we've said more within the pathway guidance. We've said more than we ever have dared to before about reasonable expenses in terms of the things that could be included within that. We've also said things about surrogacy agreements, which are routine in terms of UK surrogacy organisations, but not something, because they have no legal status, not something that the government has acknowledged before, but we have within the guidance. And that was something that was picked up by the press. And also perhaps something that we didn't think would be picked up in terms of coverage, but there was quite a big thing about informing the child of their genetic origins at the end of the pathway. So that was a really quick whiz through. Credits where they're due. Some people are here and some people aren't, but thanks to Alan McClellan, Natalie Smith from Surrogacy UK, Sarah Howarth and Kim Cotton from COTS, to Helen Prosser from Brilliant Beginnings, Sarah Norcross I mentioned before, Rachel Carter from the Royal College of Midwives, Francesca Stein from the Royal College of Nursing, and Emily Halliday from CAFCAS. And that's me.